In the Ronquillo, and I'm going to talk about a patient expectation and satisfaction with different prosthetic treatment modalities. First, the definition. A dental prosthesis is an artificial element intended to restore the anatomy of one or more teeth, also restoring the relationship between the jaws, while returning the vertical dimension and replenishing the teeth. The main objective is to recover the functionality of a mouth. It is the basic for the well-being of the patient. The application in odontology. In dentistry, there are various types of prostheses, which will be selected depending on the need of the patient. We have partial and total removal prostheses, face prostheses, and prostheses on implants. For the selection of the prosthesis, we must first perform a clinical analysis on the patient to select the one that best suits their case.
Hybrid prosthesis is the name used for a detachable denture. The hybrid prosthesis is similar to the total prosthesis in terms of looks, but the hybrid prosthesis is anchored on the teeth and implants. In the top picture, you see an upper jaw hybrid prosthesis from the perspective of the outside. Below, you see the prosthetic base. Clearly visible in our image are the incorporated holding elements called patris. The opposite element, called matris, can be attached to both a tooth and an implant. In the bottom picture, you can see two matrices in the upper jaw, attached to two implants in this case. In general, there is a distinction between two prosthetic methods, which are characterized depending on how the chewing motions are transmitted. If the chewing pressure is directed into your bone, the jaw, this is called a bone-supported prosthesis. If the chewing pressure is transmitted into your mucosa, these are called mucosa-supported prosthesis. Hybrid prosthesis can be both mucosa and bone-supported. As a general rule of thumb, a mucosa-supported prosthesis requires only two anchor elements per jaw. This significantly increases stability, and the need for a plastic palate in the upper jaw can be avoided. There are many taste receptors on the palate. Thus, this method can increase your quality of life considerably. The question of whether two or more anchor elements must be used depends on several factors, including your remaining teeth and the implant system. However, the hybrid prosthesis does not have to touch the mucosa. In this case, it is known as a bone-supported hybrid prosthesis. In a bone-supported hybrid prosthesis, the chewing energy is usually transmitted into the bone via implants. This concept requires at least 4 implants in the lower jaw, and at least 6 implants in the upper jaw. The advantage of this method is vastly improved chew quality. Biting into an apple is possible, for example, and you're spared from pressure spots and the underfeeding that can result. The only disadvantages are higher costs. In earlier days, steg-supported prostheses were often used. Here you see a lower jaw with a fixated screwed-on steg sitting on 4 implants. The counter-element is incorporated into the prosthesis and can be seen in the bottom picture. Because of contemporary connector elements, like conus connections, which are much cheaper.
The pros and cons. The pros. Present functional benefits. For example, eating, and gesturing words. Also, replace missing teeth, improve aesthetics, and there are several inexpensive protests. They have an intense period of time. And the cons is difficulty chewing, and it requires different care and may cause oral irritation and bad smell if they do not do the proper cleaning. Also applied in Ecuador. In the dental clinic of the University of Guayaquil, a study was carried out on a patient with removable prostheses presenting lesions of the oral mucosa, caused by the accumulation of bacterial plaque, reactions to the materials used in the manufacture of the prosthesis, and mechanical injuries of prostheses. the conclusion. In conclusion, dental prostheses have the function of restoring aesthetic showing and helping the patient shallow. Above all, if there are many laws of teeth science, the teeth are a very important part of our appearance. The objective is the satisfaction of the patient and to fulfill all the expectations of her. Thank you.